Thanks for joining us, everyone. We'll be starting in just a few minutes. Welcome, everyone who's joining us now. We'll be starting in just a couple minutes. Hi, Dr. Mitrani. Are you able to do the screen sharing?
Okay, can you hear me?
Yes, I can hear you.
Okay, perfect.
We can see you as well.
I had to restart the computer. Let's try this again.
Okay.
Yep, now I can see it. Can you
Perfect.
see it?
Yeah. So we're gonna get started here in just 2 more minutes at 5:05 Eastern time.
Perfect.
Just give a couple more minutes for people to join. All right, we'll get started now. Hi, Club Med virtual members. Thanks for joining us. I'd like everyone to give a warm welcome to our guest speaker, Dr. Mitrani. Dr. Mitrani is the Chief Science Officer and co-founder of Organocell Regenerative Medicine Incorporated and co-founder of the American Cellular and Anti-Aging Center in Ecuador. We are incredibly grateful for this shadowing opportunity and really hope to learn a lot today. As a reminder to our Club Med virtual members, if you'd like to have your camera on, we highly encourage it, as long as you stay on mute while Dr. Mitrani is talking. There will be a survey given at the end of the session for Wayne State University students to obtain shadow and attendance hours. And just to reiterate, only Wayne State University students present today can receive hours. We are also recording the session, so to anyone watching from YouTube, hello and thanks for watching. And with that, I'll turn the session over to you, Dr. Mitrani. You can take it from here.
Thank you so much. And thank you everybody that decided to join today and everybody on YouTube that are rewatching this. It's an honor to be here, our second time with Club Med. For me, this is part of the things that I love to do is try to shadow, mentor, or guide new colleagues, because one of you will be in the future a physician as well. Today we'll be talking about regenerative medicine. That is my specialty. That's the area that I am working with. And let's see if I can go there. Yes, my name is Maria Inés Mitrani. I go for Mari, as short. And I did receive my medical doctor degree in Ecuador. I am from Ecuador, South America. I studied there. I was born and raised. For me, medicine was always part of my life because my dad is a physician. My dad and mom run it's like a day clinic. So I was born and raised in that environment of always knowing and understanding what a clinic patients are. So it was not until my 10th year of high school when I really with all the basic anatomy, physiology, I went into like really the interest of becoming a physician, a doctor. I saw it as an opportunity, and definitely I always was so passionate about it from that point on. I also got my Ph.D. in specifically neural therapy, which is the sympathetic and parasympathetic nervous system. And I got a doctor in acupuncture degree as well, or Oriental medical degree. And recently, I just received from Cornell my plant-based nutrition certification. Nutrition is what really makes us, and what I think is lacking from our medical career. I mean, we are the center of when a patient has a need, or when a patient needs a real advice in anything that does with medicine, we should be able to coach them also in the basics of nutrition. And I think that is an add-on that I always wanted to pursue, and I recently received this degree as well. This year, I was awarded with an award, the top 100 healthcare leaders 2020, 2021 by IFA, from all the work that we've done in COVID. And just so you know, every year we still don't think that once you finish med school and your residency, you're done studying. Every year you have to keep studying and keep getting updated. In my field specifically, I work with different programs. So I'm always updated on the human subject research and everything that has to do with the regulatory and clinical trials based on the US FDA, because that is where we are running our trials here. A little bit about the past and the present. This type of field has brought me into getting to know so many patients, unbelievable stories, because it's such a new field in medicine. We've been able to see quote unquote miracles meaning that regular medicine did not have an approach or a solution for these problems. And this field is offering an opportunity to improving the quality of life of patients. So stem cells and cell therapy and gene therapy is a specific type of therapy that is there to offer that extra quality of life for patients that did not exist before. So this is what I'm doing now. I am the Chief Science Officer of a public biopharmaceutical company. Our headquarters are in Miami, Florida. This is the Life Science and Technology Park building of University of Miami. And we are committed to the research, development, and manufacturing of new biologic medicine. So we are producing drugs, but they're biological drugs. And we're registered with the FDA as a human cell and tissue establishment, and that is how we're producing our products. So what is regenerative medicine? So regenerative medicine is the branch of medicine specializing in the replacing, engineer, or regenerating human cells, tissues, or organs. But the most important thing is that it optimizes the human's body's natural ability to heal itself. So that is the field that I've been working with and the field that I am so passionate about. And to give you a little bit of insight, so you leave today with some understanding of how this field is progressing through. There are two different, I like to separate it in two big different blocks. Is either we're doing an autologous process or therapy, or an allogeneic process or therapy. So autologous means that it's coming, the cells or the tissues are coming from your own body and going back into your own body or the patient's own body. And allogeneic means that there is a human that donated those cells or tissues and are being implanted in a different human. So those are the two biggest branches where cell therapy or regenerative medicine therapy is based on now. As autologous therapies, you must have heard from PRP, right? If you have not heard, everybody that has is in the orthopedic or pain management, they are doing this type of therapy where they take your blood, spin it, put it in the centrifuge, and then just collect the platelet-rich plasma, which is the PRP, and inject it back into you. So that is the simplest, the easiest, more approachable type of example that I would give you. Other examples with cells or tissues are also collecting the stem cells from bone marrow. Those are more like the hematopoietic stem cells, and adipose or that derives stromal vascular fraction stem cells, and then reimplanting on the same patient. As example of allogeneic therapies, the biggest, most used and most explored, most researched about is the one that is derived from the placenta or the perinatal tissue. The perinatal tissue is the tissue that is between the mom and baby, and it's collected only during C-section, only in the OR, and where you are able to screen the mom as a donor and make sure that after you follow all FDA guidelines on what a donor needs to be and how you can actually utilize either cells or tissue or proteins from that donated tissue that comes from the placenta. So most of the people, when they hear about stem cells, and that is like one of the biggest myths that exist in our field, is they think that stem cells are associated with aborted fetuses. So know that there is plenty of stem cells in different other forms that are not required to be aborted fetuses. As I'm saying, these are only healthy planned C-sections where the baby is born full term, the mother is perfectly deemed as a donor, and this tissue usually is considered a medical waste and it's discarded. So this is what part of what we are doing as an organization, utilizing this specific tissue so we can create a drug. It's been many years that we've been working with, at the beginning, autologous stem cells. Then we moved into allogeneic stem cells. from the placenta or from the perinatal tissue. And now we've moved into a drug that we've manufactured called Zofin, which is an acellular drug. So there's no cells, no stem cells in this type of drug, but we are maintaining all of the nanoparticles that are present in the tissue at and where all of the cell communication is held. So to give you a little bit of overview of what is in Zofin. So we are maintaining around 300 different proteins. These are small proteins and they're cytokines, chemokines, growth factors. And this type of molecules or proteins are specific signaling molecules that tells the certain cells what to do. What are those? And just to give you an overview example of the most the ones that are composed the most in our product are these ones that are listed here, and they are pro-angiogenic, anti-inflammatory, immune modulatory, tissue repair, pro-metabolic, and those are the things that these proteins are signaling, right? Another component of the drug is hyaluronic acid. Hyaluronic acid is a component that helps with, it is, how do I put it in easier terms? It's perfect for hydration, let's say, and to sustain a lot of things. So hyaluronic acid lately is extremely used in orthopedic procedures, just as a cushioning substance. And lately in the aesthetic market is booming as they're using it, not as fillers, but it's a filler that gets absorbed quicker than the other fillers, but it's the new boom as well. So hyaluronic acid is a component that it's present in all humans, but we are getting it in a very big grade. And what we have studied the most and what we're focusing on is these extracellular vesicles or exosomes. Extracellular vesicles are these vesicles that are produced inside of the cell, and they are produced by any type of cell, different types of cells. And this is how cells communicate with each other. So exosomes work as the information messenger to different cells. And depending on the origin, the information that's transferred, they can actually alter what the recipient cells are supposed to do. For them to be considered an exosome, so an exosome is an extracellular vesicle, but it is a smaller in the smaller section. So they have to be between 40 to 200 nanometers. Every year, there's new sizing structure. So 120 nanometers is the latest. So just know that extracellular vesicles are produced by cells. They're carrying a specific message, but the ones that are smaller ones are considered exosomes, and these exosomes have to have different things for them to be actually target or named, for them to be named exosomes. So what are these lipid vesicles carrying? Because they are produced inside of the cell, as I mentioned. So what they're carrying are proteins, microRNA, messenger RNA, enzymes, and this is what is bubbled inside of the cell to then be excreted out of the cell and released to cells that are close by and also cells that are very far away from where they were secreted. So this is what we've decided to study, and what our company has focused on specifically is understand these extracellular vesicles, the importance of the cargo that's inside of these vesicles, and how can we quantify, target and understand where are they coming from. So Zofin is composed of around 200 to 400 billion exosomes per ml, or extracellular vesicles, but we've done an analysis to understand what is the size of them. As I said, for them to be considered exosomes, they have to be in the smaller, and our average is 100 nanometers. Before, interestingly enough, we did not know that these lipid vesicles that were secreted from the cells were carrying something. We consider this as garbage that was secreted from the cells, but now I would say in the last decade, we have the ability to have this kind of software and different techniques and machinery that we can actually see, quantify the size and see what's inside of these vesicles. And this is a nanosite. It is a machine that passes light through these extracellular vesicles, and we are able to quantify, not only quantify them, but actually see the size and the amount of them that exists in a specific product, right? So that is our biggest thing that we've been doing is understanding these extracellular vesicles. So with this information, we have presented to the FDA just as COVID happened, all of our preclinical data, everything that we've been studying before, so we can actually study this drug as a drug under FDA approval. So two of the biggest things that we were studying in one side was in the orthopedic side, osteoarthritis of the knee. And for lung injury, we were studying to develop a treatment for COPD, or chronic obstructive pulmonary disease. And we study a model of bronchopulmonary dysplasia just when babies are born, they're exposed to oxygen. And when they are too young to be exposed to oxygen, those alveoli or the lungs are not ready to understand oxygen yet. They are soaking in liquid. And when they're exposed to oxygen without the timing, those alveoli burst and they create this disease called bronchopulmonary dysplasia. And it's something that we were studying for a long time. We were collecting a lot of data, and it's with all of this data on the lung injury model that at the beginning of the pandemic, we were able to pivot and translate all of the data into ARDS, which is the acute respiratory distress syndrome due to COVID. And FDA granted us the approval for us to study our drug in COVID. And throughout a year and 7 months, not only that we launched that study, but we were able also to present different case studies, meaning one patient, single patient reports where we treated different cases of COVID, meaning the acute, then we treated ICU patients with COVID, and also the long hauler patients. So it's been an insane year and 7 months. Besides going through COVID, we did present our trials that were programmed for COPD and osteoarthritis. We have received the approval on those. And as a company, we're focusing right now on getting our COVID trials going. We have a phase 2 approval as I was mentioning, the COVID specific scenario. And recently we also got an approval for the long haulers. For those who are not familiar with the long haulers, it's the type of patients that contract COVID, the acute COVID infection, and after 4 weeks, we expect for the infection to go away. But there's patients that are left with a lot of symptoms, and mental fog being one of the biggest complaints. But they are, because COVID is so it affects so many organs. We are seeing many effects in different organs. So we have named it as the next pandemic that is about to come, just dealing with these patients. So I'm here to present you also this case is one of the cases that was approved under FDA trials for a single patient. This is a 55-year-old male who weighs 79 kilograms. Patient has been hospitalized for 7 weeks due to mild to moderate acute respiratory distress syndrome due to COVID-19. During hospitalization, he was admitted twice to the ICU, was never intubated. And then he was discharged. At the time of discharge, the patient was physically limited due to severe deconditioning and having shortness of breath while performing limited activities as eating meals, showering, short distance walking. So patient was even referring that walking from his bed to the bathroom or just brushing his teeth, he just couldn't do it because of the shortness of breath. Um, Chest x-rays revealed bilateral pneumonia at baseline. Baseline is before we did treatment. So this is a patient that is not hospitalized. This is a patient that's seen his physician outside of the hospitals. We have, and this to give you an overview on this specific case, but most likely these are the things that we're looking in our bigger trials as well with all of our patients. A confirmation that the patient in fact contracted COVID. All patients sign an informed consent. Informed consent is overviewed by an IRB, an institutional review board. The demographics are taken, medical history, a physical exam is taken. We like to have images of chest x-ray or CAT scan if possible. And we are doing all laboratory testing of CBC, differential, metabolic panel, but most specifically, we focus on the inflammatory biomarkers because we really need to understand how inflamed was the patient or how can our drug really reduce this inflammatory biomarker. So we look for IL-6, TNF-alpha, D-dimers, CRP. And interestingly enough, we've learned, and with the latest publications, we are collaborating with a physician that is treating up till right now over 10,000 patients with long hauler, and they have identified a panel of 20 different biomarkers so they can assign a scale of the long haulers. It's a very interesting information that we receive, and now we're implementing it in our study. And all of this laboratory testing that we do, we're doing it day 0 is the day of screening, and in the day of treatment, day that the patient receives the first treatment. Day 4, day 8, day 12, 21, and 28. Then there's follow-ups with the patient, but not getting their blood drawn, right? We are treating 3 times with our product, day 0, 4, and 8. And all the time, and the most important thing, as this is a new drug, we are looking for adverse events. So during infusion and also after 24 hours and throughout all of the follow-up, this is what we look for in the trial. This specific patient, on the day of first treatment, the patient's saturation was low at 96%. By day 8, prior to the 3rd dose, the patient reported already no signs of fatigue and shortness of breath, and O2 saturation improved to 97 to 98 after that first dose. Furthermore, chest x-ray at day 28 revealed no evidence of procedural pulmonary abnormalities, and patient was able to go back to work in the OR after 1 month. This patient was a physician, a surgeon, so he was able to go back to work and help more patients. So this is a very interesting case that was actually published recently. We got the final approval, peer review publication of this case report. We're very excited as a team to be able to have this out there, so you'll be able to, anybody can go read the publication. These are the things as a physician, as a scientist, we want to make sure that everything that we're studying, the mechanism of action, the ways that we are anticipating and theorizing that our drug works, is eventually gets to the patients and gets to work, right? So again, this is only one case, an individual case, and that's why we are doing our double-blinded, placebo-controlled, multi-trial, multi-site trial, because we want to understand how the drug behaves with different with the population of the long haulers in different people, right? Not only one. So I always have a little quote at the end, and this year has showed us how really scientists and people that are working behind the scenes can make a difference. So don't give up. Science will show up. Us that are behind the scenes working on the therapeutics, specifically at Organocell, we're working hard to bring the trials to an end, and hopefully to have an approval of this type of drug that is a biologic drug. So this is where you can find the company information and my personal as well. I'm always available. I think more and more people are needed in the fields, specifically after this pandemic. There's a lot that we have to do. There's a lot of work that needs to be done. I love to encourage all females, all minority. We need representation. It's very important for a patient when they come to see you and they see themselves in you, the therapy goes way better. So know that I am here. You can always reach to me if you have any questions. Please let me know.
Perfect. Thank you so much. That was a really amazing presentation. We're going to open the floor to questions now. So if anyone wants to ask Dr. Mitrani anything, you're welcome to unmute yourself or send a message in the chat.
Yes, and don't be afraid to ask.
I have a question.
Of course.
I don't remember if it was on your slide, but did the patient have any side effects from the Zofin?
No side effects have been reported yet in any of our trials. But we're actively, that is what we're looking. FDA is very concerned of safety. So that is one of the biggest things. Same as with the vaccine, I would say, that has so many patients already enrolled in their trials. Safety is the number one thing.
Someone asked in the chat, what was your undergraduate major?
So I went to school in Ecuador, and like the format is a little bit different. So once we graduated high school, we go immediately into med school, even though our first 4 years are, which are your college years, are all basic science. So I went to study medicine since I was 18. So I went from high school straight into med school, which are 8 years. So there's not like you don't get to pick. You just get assigned absolutely everything throughout the career.
Another question we had here with the Zofin trials, how long was the patient positive before the initial treatment?
Yeah, so the patient was 7 weeks in the hospital before he was discharged from the hospital. And after discharge, he was 1 week at home before he received treatment. So since he started feeling symptoms and went to the hospital, it was 8 weeks since he contracted COVID.
Hi, sorry, I'm like in a public area, so I was trying not to unmute, but because there was like a vacuum going off, but I think I'm okay right now. I was also curious if like y'all were possibly thinking for more than just the long haulers, but like as a COVID treatment, like for everyone.
Yes, that is what we started with. And those are the trials that we have going on right now. In mild to moderate and moderate to severe stages. Those are this drug is a proposal for an active COVID therapeutic. And those are the trials that we're looking for right now. But besides an active COVID therapeutic, we are also investigating on those with the sequelae, with the ones that have left with symptoms.
I actually had a quick question too,
Mhm.
related to, again, the Zofin trials. So, side effects were mentioned earlier. So if it was found that, a patient that you're having take the experimental, drug was found to have side effects, what would that mean for, your existing patients and your future patients?
That's a great question. So side effects are divided on non-lethal side effects or non-severe side effects, and then severe adverse events, the SAEs. So that is there are two routes of how you handle those severe adverse events. And as you know, every single drug that's out in the market does have adverse events that are reported throughout the trials, but those are non-lethal or non-severe adverse events. If there's severe adverse events, like we saw in one of the Moderna trials for a specific bracket of population, there is a pause on the trial. So until FDA or the regulatory in Europe reviews how were those cases, what happened with those cases, and decides if the trial continues or not continues. So as I'm saying, the most important thing is to know what is the grade of adversity of events. And that is how our regulatory umbrella, which is here in the US, the FDA, they decide if the trial can continue or not.
Okay, thank you. There's another question actually sent in the chat. What was your reasoning for completing your PhD in neurotherapy?
Well, I thank you for the question. I was actually thinking on, I always envisioned myself of being a physician and taking care of patients and seeing patients day in and day out. I was going to be, in the clinic all the time. So my father has that specialty. I love what he was doing. I was pursuing that, and I was going to see patients in my head. That's what my future looked like. But then the opportunity of understanding stem cells presented itself. And back then you could not go to school and study this specific thing. There's still no you can study cell biology and understand cell biology, but there is nobody that's teaching you therapeutics with stem cell, because we're just learning what stem cells are. So it was something that we decided to embark on and learn every day. This field evolves so fast that in 6 months, we will know new things that we didn't know. So I did never envision myself on managing a business and being in a different way, which is, I never thought I was going to be overseeing a laboratory and seeing production and running clinical trials, but that is what life threw me. And I am so happy that this is my journey. So know that once you graduate as an MD, you have an infinite variety of ways that you can end up being an MD. I'm still, even though I'm not seeing patients every day in the clinic, I get to see and oversee the clinical trials and see how patients are impacted with what we're doing. So thank you for the question. Yes, that brings us to this. There's so many things that you can do after you graduate as a physician.
I have a question. So I know earlier we were discussing like the importance of nutrition as it relates to our well-being. So what do you suggest, or I mean, I know we all know like vitamin C and eat your fruits or whatnot, but is there anything that you suggest like to all your patients, say maybe not when given the Zofin, patients with COVID-19, just overall?
Yeah, well, there is so much scientific evidence right now on how important it is for us humans to thrive in a 80 to 90% diet based on plants, on whole food plant-based diet. So not only for COVID, because COVID, there's also large amount of information on how not that COVID cannot be contracted, but your severity or how bad you're going to end up if you are obese, hypertense, diabetic, and those are all related with diet, can be impacted by COVID. So that the suggestion, not from me, but from all the scientific evidence that is out there, just eating more whole food plant-based, meaning, and not only your vitamin C and oranges, right, is all of the fruits and vegetables. And as I put it, because I like to put it in the simplest way, if you every day can take all the colors of the rainbow, did you eat them today? Right? And whole grains, for example, quinoa, brown rice. People are scared of carbs. We thrive on carbs, on complex carbs. That is our fuel as humans. That is, as animals, we thrive on those. So make sure that you are getting that. And all vegetables, seeds, nuts. You have to just, we all have a room to increase the amount of whole food plant-based that we are eating. So yes, big proponent of that, not because of me, but because of the amount of scientific evidence that exists. I mean, the American College of Cardiology is high proposal. The American College of Oncology is a high proposal. So it's not a crazy hippie group that is saying you gotta eat more fruits and veggies. And it's not only fruits and veggies, but nuts, seeds, whole grains as well. So yes, nutrition, keep it there. Nutrition and also business. Physicians, we are taught a lot about how the body works, how our physiology, anatomy, and how medicine works, but we're never taught enough about business. Once you get, after so many years dedicating your life and to understanding how the human component works, then you're there like, now what? How do I make my living? So if you have a time to push some kind of business administration around there, know that you can push. It's important. I read you everything today.
Thank you. I had another quick question as well, actually. So, all of us, or at least most of us, are undergraduates, so we'll be applying to medical schools, within the next couple of years.
Mm-hmm.
And one thing that a lot of people are considering, more and more, is taking a gap year. So I was just wondering if you had anything to say about that.
A lot to say about it. Thank you so much, Mohammed, for bringing it up. I recently was part of a summit called Ending Physician Burnout. And part of the summit, we learned about this movie called Do Not Harm, which is what we plead as becoming physicians, right? And there is this large amount, and my voice breaks because when I got to learn that there is so much suicidal risk for residents and especially med students, if there's something that I can say today to you, is that you're going to go through one of the toughest times of your life, but there is a light at the end of the tunnel. You're going to go through emotional, physical misery, but your passion, your reasoning of why are you going to do this has to be so strong. And know that it is totally okay to take 1-2 years. It does not matter. You're never late. You're going to be practicing as a physician for the rest of your life. Like I was just saying to one of my friends, like I just gave an exam, and it's been so weird not to being given exams every single day for so many years, like that we were just doing that. So yes, your mental health is the most important thing. Take time. One of my friends, and thanks to social media, for me, that is my avenue of disconnecting, of recharging, right? We all have different ways of disconnecting. And one of my friends who's a resident, ER doc resident, he was saying one of his things that saved his life is that he always dedicated through med school to his passion. So he continued to doing music, and he continued to learning as a med student what he was learning. So music was his avenue. I do a lot of I love to work out, so that is my avenue as well. So you gotta find your way, your passion, your outlet, because we are going to be put through so much. All of the physicians and the healthcare providers that are still working right now in the front lines have had the toughest time of their life. It has not been easy. It has been very, very tough. Just working a regular year that was not a pandemic was extremely tough. So know that it's going to be hard. There are going to be days and nights that you will be feeling extremely lonely, but looking for help and taking your time and taking a year, a month, a week, 2 years away from that until you find your balance again. We need clear physicians that are focused.
Thank you for that. Yeah. I think a lot of people, including myself, sometimes feel like, there's a big rush to get into medical school and stuff. So, it's
Yeah.
nice to be reminded that it's really a lifelong journey.
It is forever. And it's so heartbreaking to hear that med students are in the biggest bracket of suicidal rates, and that females are even more prone to male suicide. It's like how in my head I could not understand that until these last 2 years, where I was put into really difficult times, and I never thought that I would need to look for help. And I am so glad that I found help, that it's really is like there's nothing wrong with asking for help, and that what you see that moment can be like there's no way out, and there is always a way out. So I know that as doctors we are built as thinking that we're the tough ones, we are the solving ones, the ones that are going to give everything out, but our healers need healing. So no, it's okay, it's totally okay to look for help. And you're about to enroll in a journey that it's so rewarding. It's so rewarding, and knowing your why, your purpose, and continuing with our purpose, that's what's going to fuel you through the nights that are unmanageable, and dealing with, once you're in the hospital, dealing with real people and real problems, where you really have to take a step back, breathe in, breathe out, and just continue and focus, tunnel focus, and because you can really save lives from a split second. Any other questions?
I guess you mentioned, how COVID has really changed a lot about how you work and your outlook on, the work you do. And I know that a lot of the work you do is related to helping people that have faced it. But if you could just talk a bit more, I'd be curious about how COVID has changed, how you maybe deal with patients, or how you approach situations in healthcare.
Well, for us, for our company, and for me especially, COVID completely changed our program. It was a great thing because usually it would have taken a long time, many years, for us to present our preclinical data to FDA and submit it for COPD, which was the most developed plan, and then osteoarthritis. But COVID gave us the opportunity to act really fast. And I'm really grateful that I have a team of scientists, regulatory, and physicians that were ready to jump on something like this. It's a pandemic that we've never seen, a virus that we've never seen in humans. So the entire medical and scientific community did not know what to do. and there's some kind of way that we are learning how to navigate, at least not to lose the amount of people that we were losing at the beginning. But still, the new Delta variant and the new variants just show how strong a virus can affect humans, right? So and that's another thing, we are working with CDC. So if you would have told me and if you're applying for medical school, so you're like what, around 2021, how old are you guys?
I'm a senior in my undergrad. I guess people are mentioning in the chat, but all of us are probably, between our junior, sophomore, and senior years in undergrad.
Yeah. So if you would have told me when I was 18, 19, 20 that I would be working with the CDC in 20 years, I would have never, ever believed you. We are actively working with one of the biggest organizations that is looking for really finding solutions on what are this kind of virus, the virus with a pandemic potential. And I'm really grateful for this for this time. It's been a great opportunity, but the same, I feel like I'm back in med school because it really brought me back to not sleeping at night, brainstorming like hell, and relying on a team that is fantastic, because it's all of this is a team effort. So yeah, for me, COVID really changed my life. To be able to receive an award on the recognition that the work that we've done in COVID, and be named one of the top one of the 100 top healthcare leaders was very spectacular. So yeah, as a physician, as a scientist, I'm a physician scientist that even though does not see patients every day, is still very involved with medicine.
Thank you. Another thing I know that a lot of people kind of get, I guess, intimidated by is that there's so many fields in healthcare, and there's so many different things you can study and choose to specialize into. So do you have any advice for people who are still kind of struggling and trying to figure out what they want to do?
Yeah, I would say, and thank you for that question. I would say just study medicine first. When it's your time to decide to apply on your residencies, that time will come. Most of the times you apply for 3-4 things, you're picked in one, you don't match that year, you have to do a year of research or learn different things. But life is so beautiful that gives you so many different turns and twists, and you end up doing what you never thought you were going to. But it is not until then that you really should be worrying about. Adding one more thing to worry about on what am I going to be when I grow up is first focus on learning medicine. There are many years that you have just to study a lot. So do that. Take one day at a time, one thing at a time, because there's a lot that's coming. And again, if you are fueled with the passion of helping people, it really does not matter where you are in healthcare. More people are needed, more females are needed, more people that are not your regular doctor that's presented in the high screen. So representation matters, minorities matter in medicine.
Absolutely. Thank you so much.
You're welcome.
If there are any other questions, I guess we can start wrapping up here.
Thank you, everybody, for your time, and for everybody that's watching us too. Thank you.
Huge thanks to everyone for dropping by. We'll be sending the attendance survey in the chat shortly, so keep an eye out for that. Dr. Mitrani, if you have any social media information you want to drop in the chat or anything you want to share, I'm sure people would be happy to follow you.
Of course, I am very simple. My name is Mari Mitrani, and that's how I go for. So yeah, reach out if you have questions, and if you have anything that if you didn't want to ask here, feel free to stop by my social media. I'm active on Instagram. I have to still learn Twitter, but and LinkedIn also when you are ready to have a LinkedIn, let's connect. I would love to hear from you, all of you.